Hey guys, it's Dr. Stephen Vincent, or many of you know me as Dr. Gunny. I have something really cool that I'm going to share with you today. It's called the rubber band syndrome. So here we have a simple rubber band, and here's what we're going to do. I'm going to take this rubber band, and I'm actually going to place it tightly around about the middle of my pointer finger here. So let's get this down just a little bit. There we go. Alright, so there it is, the rubber band placed real tightly around the middle of my pointer finger. So as we can see, the tip of this finger past this rubber band is actually starting to discolor. It's turning a brighter pink. It's actually going into red now, and as we sit here and wait, it's actually going to start turning into a purple. What's happened is we've put some interference interfering with the blood vessels and the nerve supply to the tip of my finger. I'm actually losing feeling in this. It's actually swelling a little bit, and now I'm starting to feel just a little bit of tingling as that feeling is going away, and I'm feeling some throbbing going on right here. So what do we do about this? I've got all of these symptoms I'm feeling, this weird coloration, this pain, this tingling, and all of this weird, and it's actually hard to move that joint because of the swelling that's happening on here. So some of the things that we could do, we could rub some ointment or salve on this to try to change the discoloration of this finger. We might be able to take some pain medications to actually help with the throbbing that's happening, because it really is beginning to throb quite a bit right now. We might even go as far as to get a steroid injection right here at the side of this pain to help with the pain again. All right, and let's say that none of those things work, so we just continue on with the American way of doing things, and we just decide, listen, it's really bothering me now, let's cut it off and do away with it, and then we'll be good, right? So that's what we would do. Well, I mean, who's with me on this? That sounds pretty absurd when we know exactly what's going on. Even though all of these symptoms are present, we know exactly what's going on. All we have to do is just start to remove the interference that's happening around that site. So we take this rubber band off, and immediately I feel blood running to the tip of my finger. The discoloration is actually going away. I'm feeling more movement in that joint. The swelling is going down, and I'm actually regaining all of the feeling that was gone in that joint there. So this is a really quick and easy way for you to show people why you and your family come in and get adjusted, and why they need to as well. It's important for us to realize, though, that not all of the symptoms that we might be having have to do with any pain. Some of the things we might be noticing in our body may have to do with just function. So we may have acid reflux or asthma and things like that. So only 10% of our nervous system actually has to do with pain. The rest of it has to do with function. So let's take a look. So if we look at this area here, and let's say we had some interference right here in the neck, and we noticed that along the way all these nerves going down into the hands. So we may have signs like what they would be considered carpal tunnel, maybe some numbness and tingling in the fingers. And let's say again that it didn't even have anything to do with pain. Let's say we had some interference right in here, and these nerves go across over here to the heart, and maybe we have some high blood pressure, maybe some increased heart rate and things like that. So it's important for us to realize that it doesn't have to be about pain, and that's why it's so important to make sure that you're getting checked to see if you have any interference in your spine and nervous system. We call that subluxation, and that's a real important term that I want you to remember. So call the office and let's see if we can get you in and see if there's any interference that I might be able to help you with. This is Dr. Stephen Vincent, the Amarillo Chiropractor.